You're here.
Oh, there I
Okay,
am.
there you are.
Hi.
Okay, I can hear you through here just perfectly. So we are excellent. How's new life in Del Rey?
It's beautiful, sunny. Can't complain, honestly.
Amazing. And moving in the middle of a pandemic must have been interesting to say the least. I did it too.
Yeah, I somebody with my anxiety level, I would not recommend doing that again if
Yeah.
it were me. We did it. It went pretty smoothly given everything. We moved with two cats on a plane and staying in hotels and
Oh
going to a
boy.
house we never actually set foot in.
Oh
So
wow.
it was a lot, but it was great. It was a great decision, and it's
Good.
beautiful here. So loving
Your
every
new
minute.
office looks amazing. I love it. People are always commenting on my background, but I want to paint my new bedroom your color. It's
I will
very,
send it.
you know what's amazing about it is it's like the quality in your voice, the tone in your voice. You have such a soothing sounding voice, and I
Oh,
feel like that color on the back of your wall is exactly reflective of how you sound, which is I think
thank
probably one
you.
of the benefits you bring to patients when you talk to them is that you instantly infuse this calm, we can take a deep breath, we can sort of stop the squirrel brain for a minute to slow down and figure out where we're at, where we need to go, right?
Right, right, absolutely. And I think in my history as a fertility nurse, I mean, patients can immediately tell by the tone of your voice. You're
Mm.
setting the tone for the whole rest of the conversation. So I used to work really hard on trying to make sure, I wasn't too excited or too down and just, really even keel, but, having that supportive, compassionate, subject matter, it's such an important characteristic. So
One
thank
of
you.
it, and you're welcome. Thank you for talking to me so that it instantly makes me feel calmer. One of the things, Lauren, that I can connect with about that concept, though, is that you might have just come from someone who was really struggling with a loss or with a failure, and you're so empathetic by nature. How hard is it to context switch then to go into the next room and put the hopeful face back on? How hard is that for
Yeah.
you?
Well, I wouldn't say that it's hard per se. It's just something that you kind of have to learn how to juggle your emotions a little bit.
Mm,
So, some of that compartmentalizing of once you leave the room that you might have had to give some difficult news. Okay, I'm going to put that aside. I'm going to come back to it later because, I still need to process everything. But now I need, somebody else needs my attention and they're going through something that's equally important to them. So, 100% they've got to have all of you.
yeah, that's right. And it is it's kind of like the muscles that you help your clients, I think, build. You've cultivated over time, and that's why you're in such a great position with Embrace Your Fertility now, where you get to be side by side with individuals and couples, helping them kind of navigate the path forward and helping them build the same emotional tool set that they're going to need to withstand then what they're going to need even to endure all that there is to endure on this journey, right?
Yes, I mean, you said it perfectly. Enduring it, you're enduring the ups and the downs because I think so many people realize that, once you get around this corner, you don't know what's next. So is it a good thing? Is it, how do you know what to celebrate? So I do
Mm,
talk all the time about celebrating the small victories because every single one is so important, when you go through this, because
hmm.
there's a lot of steps, a lot of places
Yes.
to get bogged down.
And sometimes, actually, and Nikki on our in our audience, one of our community members is asking a great question about lab results. I think one of the most common questions I get asked, and probably you'll get asked too, is what do the lab results mean? And because and I have a patient right now who I've just fallen in love with. She's becoming a friend, or she has become a friend, and she's had some scares, and she's been honing in, well, is this progesterone number normal? Everything looks great, is this progesterone number normal? And sometimes you just need that person to say, like, you're exactly where you're supposed to be.
That's exactly right. And I really, that word normal. right?
Yes.
It's so
Yes,
touchy
it
because
is.
what's normal for me may not be normal for you or Susie down the street, but obviously there's a range, that we would be looking for. So it's always
Mhm.
helpful, to help somebody with their anxiety, just to conquer a little bit of that for them to hear, yeah, you are appropriate for where you should be at this point. That's, I wouldn't want to see anything different, things like that.
So Nikki's day 3 labs came back. Can we cover the day 3 labs with you and get your feedback?
Oh, yes.
Okay, great. So her LH 10.46, FSH 7.9, estradiol 40.62, progesterone 0.4, and the AMH 0.95.
Okay. So, obviously, I'm not a reproductive physician, but having been through all the years that I've experienced this with my patients, most of these labs are normal for where you would expect someone to be at this point in their cycle. It
Mm-hmm.
is something where I think it was one of the first things I learned as a nurse, though, is that having, or in this field, is that having normal results doesn't mean everything is perfect. It just
Mm,
means that there's not right there immediately a red flag.
mm-hmm.
So having the FSH in that range is a normal level. Doesn't
Mm-hmm.
mean things are going to be perfect and you won't have any trouble, but it absolutely doesn't indicate, we need to start being a little concerned.
Mm-hmm.
Now, the rest of the labs, they all seem pretty in line for where you would expect someone to be.
Mm-hmm.
But the AMH is something that might be worth having a conversation with whoever ordered the labs for you, whether
Mm-hmm.
it's your OBGYN or if you're seeing a fertility specialist, just to talk a little bit more about your history and age with that lab result
Mm-hmm.
and based on what that might mean for a prognosis.
Mm-hmm. I agree with that completely. With the progesterone level where it is, the 0.4, not indicative of having ovulated recently, right? With a progesterone level that low.
Right.
Normally we would see it elevated. If you're pregnant, it would stay elevated. And I agree that the AMH is detectable. I mean, one of the most important things is as long as it's detectable, we can probably go in and retrieve some eggs and probably having that authentic conversation about prognosis and maybe how many retrievals to do to get the best cohort of embryos to work with would be a really good conversation to have. And if she is ovulating on her own and she certainly could still try if she's under, I would say probably under the age of 35, it would be still okay to try. But some fertility specialists might say, well, if you don't know what your AMH was maybe a year prior, we might should go in and retrieve some eggs, because what they want to do is be as protective as possible to make sure that she's going to have as many children as she wants.
Right.
And that's why we don't like delays, right? Like the second somebody starts dipping, below 1 with AMH, we just don't want too many delays to cause that, because every single month there's going to be diminished ovarian reserve. That's been happening since we were in our mother's bellies, right?
Correct.
Our ovarian reserve has literally been in a decline since it reached its peak in utero. and
Yes.
and that's tough. That's really tough every single month, no matter what we do. When you were just born and you were a month old, there was a decline from the day you were born to a month later. And so, that's what we really advocate for. She's also asking for something that I think is really compelling. And Nikki, I saw this question come through and get answered on the app too, about the difference between FemView and HSG. Was your clinic doing FemView when you were still a nurse? It's a little,
No.
I think it might be a newer thing. Our community seems to prefer HSG still, for the accuracy and the success of, what they're used for, being able to see if the tubes are open. But it didn't sound like they were discouraging FemView, just that their trust is in, for what the fertility specialists need, the trust is in an HSG. They wouldn't choose to do a FemView over an HSG in particular, just, because it's tried and true.
Right, gold standard.
Right.
Exactly. Now, the other thing too that is important is, the lab work shows one piece, but everybody is their own puzzle. And so it would be really
Right.
helpful to have, an antral follicle count done by ultrasound. So you can have
Mm-hmm.
a little bit more of a picture of really what the
Mm-hmm.
ovaries are, looking like at rest and what that might indicate as well.
Absolutely. And, Dr. Chen would say TSH level, definitely need to know thyroid, prolactin. There are other, even other lab pieces of the puzzle to continue to look at too. And so we have lots of IG Live saved under IGTV with conversations about diagnostics and everything else if folks want to kind of advocate for themselves. But what else should I check?
Yeah.
We love the concept of doing a fertility wellness checkup before there's any delay, before people even start, so that they know if their tubes are open. If you throw away a year of trying and your tubes are closed, it was a waste, right? And
Oh,
I just think that
absolutely.
this should be standard of care. Like, do at least AMH, antral follicle count, day 3 labs, prolactin, TSH, because so many of us have thyroid issues out there. So many of us. And and make sure that your guy's sperm is checked before even entering the trying category, not to produce anxiety, but to just be like, hey, great, we should just enjoy ourselves for the next 6 months because everything looks good, right? And then that way, if it does take time, you have an initial baseline, and you have the attempts as part of your data.
Right. And I love this. When I first started in this field, fertility wellness checkups was not even a thing. I remember brainstorming about other, things we could do at the fertility clinic. And, it came up
Mm-hmm.
in the very beginning, but it was like, oh, well, we really got to concentrate on what we know. And, the reason we're here is IVF. But having that information really can be so beneficial. I remember having a couple coming in who they were newlyweds and they said, look, we want to enjoy the first couple years together, but at the same time, if we know there's an issue, we'd rather not wait,
Yes.
and so just having that knowledge, of course, again, having a completely normal every test result doesn't mean you're going to get pregnant at the drop of a hat, but it would at least say, hey, maybe don't go wait for a couple, 2, 3 years before you start trying, think about it earlier.
Well, and you add also, when you get involved with your patients, you also kind of cover nutrition and cover lifestyle improvements and cover environmental toxins and things like that, so that you're not just being supportive of decision making, you're being supportive of lifestyle cleanup.
Right, right. Well, your reproductive health is linked to your general health and wellness. And I'm sure you've talked to a million, people in this sphere who have all said the same thing. Everything you do is linked to your general health and therefore linked to your fertility. So I do think that it would be negative for some, people to just completely ignore that. However, on the other hand, a lot of fertility clinics are at their capacity, taking care of
Oh
their
yeah.
patients, doing what they do best, clinically, and they just don't have that capacity to go the extra distance and tell their patients, hey, are you doing X, Y, and Z with your
Mhm.
nutrition? How's your sleep? Hey, are you and your husband having sex for fun? Not
Mhm.
just to when we tell you to. All of those things are really important and they play into your reproductive health and well-being. So I think
Right.
that it's really important whether somebody is trying on their own or going through reproductive treatments.
I think that's great. And then, if you head into treatments or conceiving with luscious hair like hers and beautiful skin, her advice, Lauren, if you're heeding your own advice, it's paid off, and and like you have such clear skin, and you have the best hair. You really
Thank
do.
you.
You're
It's,
welcome.
it's a lot of work, I'll
I'm
say.
sure it
Nothing
is.
comes easy.
Yes, I'm sure it is. Although it should dry faster in the heat of Florida, right?
Well, dries bigger. I don't know about faster.
Because the humidity.
Yes, it goes
So,
curly.
oh my gosh, Chantal did her lab work last week. They said everything looked normal, including her egg count. She is a person with infertility, though. She did do the HSG, and she does have a tube that's blocked, and the other one is partially blocked. So in that case, even though everything else is normal, unfortunately, her best course forward is going to be IVF.
Right. Right.
And
I mean, that's the pathway, that's the whole point is the uterus is the house, right? But there's a pathway that the egg and the
mhm.
sperm have to be able to meet so that they can get to the house and the embryo can, stay there and grow. So having that blocked and partially blocked doesn't mean 100% blocked, but you hear the word blocked in there and it's like, okay,
It's
well, do you
scary.
really want to go through the emotional aspect of trying and trying when you know the cards are stacked against you, versus going to IVF, which will have, certainly a better chance of success because we're bypassing the tubes. So we don't care if they're blocked. We're
Right.
going,
We're going straight for the uterus. And the concern with a partially blocked tube is the high risk for ectopic.
mm.
You know,
Well, and that's why fertility clinics are so great, and they hopefully have this well documented in their records, and they stay on
mhm.
top of everything with the lab work, and they monitor so early that we can really make sure that we can hopefully, obviously can't 100% avoid something, but hopefully catch something early if there was to be something that happens because of that.
Hmm. April gets her workup done tomorrow. Hooray. I think your HSG or your lab work, April, which one? But I'm excited about that. Lauren is okay. So Lauren is one of our community members who had her 20-week appointment because she's pregnant and it took her a
Yay.
whole year, everybody. So hang in there. She's had quite the success story. The sono tech said that her placenta was laying low, no bleeding or pain. Will it move up, Lauren? What do you remember back from when you were doing your rotation for pregnant patients, what that meant, and is there anything she can do?
Yeah. So I'm going to have to defer on that one. Honestly, it's been a long time since I took care of somebody at 20 weeks. With in the fertility clinic, we see people very early and then they graduate
Mhm.
by about 8, 9 weeks and they see their OB for the rest of, the monitoring. So my knowledge is so, focused in
Yes.
that part. Whenever I meet people, I say, oh yeah, I'm a nurse. And they say, oh, great. And I'm like, well, but hold on a minute. I can't necessarily save lives. I am
Right.
CPR certified, but I'm really good at making lives, so
Yeah.
there's a difference.
Yes. Oh, that's great. I was just explaining to a patient last night about that graduation that has to happen and how hard it is for us patients to let go of our nurses.
Yes, and vice versa, to tell you the truth. I mean, right now I'm dealing with the same thing. I have a client of mine who I was with her throughout her whole IVF cycle, and we talked and spoke so much, and I was so invested with her that now it's like, okay, but I'm not talking to you as much as I was, and I really miss you. So I'm like trying to reach out. Hey, I'm still thinking of you.
Yeah.
It's
Yeah.
it's hard on both ends, but especially I think it's a big change to go from a
Hmm.
fertility clinic to the OB because when you're doing fertility treatments, you're
Oh,
in there
yeah.
so much, you're talking to them so much. It's actually not necessarily normal in the
Hmm.
regular world of people getting pregnant without fertility treatment.
Oh,
They
it's
they
so true.
only go to their OB when their OB tells them, and that's it. They're not used to the rest. But those of us who are used to this constant, frequent contact, it's really something that's felt, I think, across the board.
Oh, I agree with you so much. Oh my gosh. I was sharing with her, how vivid my memories were of even though the progesterone and oil injections were tough because she was asking me, oh, how painful were they? And I said, well, it's not so I don't remember the pain. I remember that being the harder part. But when I had to give them up, I remember being scared.
Yes.
I do, because I remember that was the proactive thing that I was doing that felt like I was protecting the pregnancy by doing it. And I was like, do I have to stop doing it? My doctor made a joke about, well, you can still, put the needle in your tush if you need to, Alice. But he's like, I promise you, you don't clinically need any more progesterone and oil anymore. And that part was hard because we get into this, it's a rhythm. It becomes this habit that we're doing that makes us feel very proactive, very empowered. And then
Yeah.
you're sort of like, okay, now nature has to take over. And now we just have to trust the process. And that part is hard. It really is.
Well, and I think it's not just trusting the process, it's trusting your body, which
Yes.
for so many people has not,
Yeah.
really been trustworthy.
That's right. I
To
mean, I
put
had
it
five losses until I used my frozen embryos,
right.
and so I agree with that. It was so hard to trust my body.
Right. Right. So you're right. You're in control of the progesterone. Then you're like, okay, I'm going to let my hand go and my
Mm-hmm.
body's just going to do what it's supposed to do. But wait, it didn't
Mm-hmm.
before. So,
Mm-hmm.
it is extremely nerve wracking. Every stage of this has some different type of stress and,
Absolutely.
anxiety provoking feelings.
Yeah, absolutely. That's why
Every
we need our
single
tribe.
stage.
That's why I love what you do through Embrace Your Fertility by, being part of somebody's tribe to help them navigate everything, clean up their life and just have that supportive, voice, have that person that you can text 100 questions to. Because
Yeah.
you're part coach, part navigator, part clinical support team, except not through the clinic, right? I mean, I feel like you wear all these different hats when you connect with your clientele and your patients that I'm sure it's hard for them to let go of having you as that lifeline.
It is. And I think, that's what you were just speaks to what you were just talking to. You have a patient who became a good friend of yours. And, it's hard when you work with somebody through something that's so intense and
Mm-hmm.
personal it's hard to not develop that strong bond and connection and want to continue
Completely
it.
true. Mm-hmm.
But that's why it's also so important to make sure that if somebody is going through this with help, that it's somebody they trust and they are confident and feel good being with throughout this process, because
Yes.
it's not something
So
you want to have
important.
that extra struggle with.
Oh my gosh, and I actually want to underscore that, Amy. I do see your note about the Sano histogram, but I promise to get to it just a sec. I do want to kind of underscore that concept. Sometimes it's just not the right personality fit between a specialist or OBGYN and the patient. It could be just simply that the communication style doesn't work. The patient might not feel like completely heard the way that they need to feel heard. And all of that is valid, all of it.
Absolutely.
Because if it's not that relationship that you're going to be crying when you have to leave at week 9, that the moment you meet somebody, and you got to trust that gut and not dismiss the feeling. You're not being judgmental in some kind of bad way. You're not being overly critical. This is one of the most important decisions of your life. And I see a lot of times people switch clinics when the personality fit was off. Great clinician, great clinic, great success rates, great everything. They sort of dove into it. Were so anxious maybe to get started that they ignored the signs that didn't work for them. And then they have a failure and suddenly they go, I wish that I didn't start with that clinic because I don't feel like it's the right fit for me. And they already spent the money. And, I it's why I love it when folks like connect with some of our experts in the app and just get a feel for them. Or we're
Yeah.
rolling out this new program, which we hope that you're going to be one of our guinea pigs on. Lauren, we reached out to you about that, where we allow people to pay for quick conversations, 15-30 minutes at a time, but a very low fee. So not a full medical consult, but just that 15-30 minutes with an expert, with somebody who has, worked in the clinic before, been or is board certified, to get some of those questions answered, because there's so many questions that come up before somebody even wants or needs a full medical consult. And
Right.
I even had something, it was so sweet. One of our community members, I connected with her for about an hour last night on the phone. And there were so many things that came up. Case in point, she's in a relationship, unsure if the relationship is a permanent one, definitely at an age where it's kind of now or never. And, in considering kind of embryo freezing or, getting pregnant now, is it going to be sperm donor? Is it going to be known donor, or is it going to be boyfriend? And I had to bring up the legal implications of all three scenarios, and all this extra layer of things that she wouldn't have known to even talk about unless somebody brought it up to her.
Yeah.
And so
Well,
sometimes you have to
that's the
have that
point right there.
conversation. Yeah.
Yeah, I feel like that's one of my biggest roles, truly, is to
Mm-hmm.
help them, anybody going through this, figure out what they should be asking their doctor too. Because
Yes.
even when you do find somebody you are confident and you trust,
Mm-hmm.
it doesn't mean that they're, fertility gods.
Right.
That they definitely have a need to confer with colleagues and
Yes,
discuss your case and all of, nobody is a cookie cutter situation in this,
that's
truly.
right. Oh,
So
truly. Yes, it's
it's
so
it's
true.
so important to, be able to ask, hey, wait a minute, are you sure I'm really ready for the trigger, or could I maybe benefit from one more night of,
Mm-hmm.
stimulation before you trigger me, because, X, Y, and Z. And a lot of people don't have that confidence to speak
Mm-hmm.
up for themselves, which I think is a huge, detriment, and
Yes.
just contributes to this cloud over the
Right.
process.
Yeah, completely agreed. So, Amy, back to your question. Sorry if I delayed you. I just didn't want to miss that point that everybody has a right to find the right doctor for them. And that's whether it's your OBGYN, your primary care, or your fertility specialist. We stand by that. It's an HSG that is the test that we look at for if the tubes are open. And water sonograms can look to make sure that the uterus is clear, but it's HSG. And I have so many people on chat that spell out the entire word correctly. And
Uh-huh.
Lauren, I'm always blown away by that because I can't even pronounce the 6 syllable, word. I feel like correct. I think it's 6 syllable, right? Hystero, is it?
Seven?
Sonogram.
Wait,
Yeah, hysterosonic.
seven, I think, unless I'm wrong.
Yeah. Did I say it right? Hysterosonogram.
Hysterosonogram, hysterosalpingogram.
Yeah.
I have to say, it just reminds me of a story. I've got my own history going through this, but I do have a daughter, and I remember when she was learning a little bit of, reproductive health and your body and how that works. I remember one time she came home and she was explaining to me what she learned, and she was talking about the fallopian tubes, and I
Oh,
just couldn't get over it.
cute.
I was like, never correct it. That is the best,
Never. That's adorable. I love that.
And
Chantel's
that's the
at
point. We all know what people mean, right? Going through this, there's so
exactly.
many different anagrams, and everything gets jumbled
Oh,
up.
yes.
And
Yes.
it's just
It's
important
a
to try to make sure
lot.
you know what you're talking about to start.
Exactly. And to remind you to do the HSG it's a very quick procedure. It sometimes causes some cramping. What ends up happening is you stick a catheter up through your cervix so that they can fill up a balloon in your uterus. That's the part when I feel like that causes some cramping. And then shoot dye, which doesn't feel like anything, into your tubes so that they can make sure that the dye goes all the way through your tubes. And if it does, then tubes are open. And so when the balloon is coming out and kind of that whole experience, it can have some cramping. Usually everybody's okay with some Tylenol. It's definitely not our favorite procedure. I do know some amazing clinicians who have a new version of that procedure to roll out and market that has none of those side effects. So I love that there's innovation happening, Lauren, because I feel like it's been decades that women's comfort level doing these types of diagnostics hasn't been taken into consideration at all. And
Right.
there's so many ways to improve upon the processes and the med devices and the procedures. And so I just love that there's a group out there who's doing that.
Yeah,
But in the
absolutely.
meantime, it is tried and true. It is standard of care. And
Yes. Yeah.
um, Chantal is asking, does she need to remove the tubes? And the answer is no. Just because they're blocked, you don't have to remove the tubes. And if there's some kind of damage or collection of fluid at the end of the tubes, then they would want to remove them because that can cause miscarriage and prevent implantation from happening. But as long as
Right.
they're sort of standardly blocked, then no, you don't have to go through that and remove them. You just have to bypass them. And
Right.
that's the part that's tough. But Chantal, we have so many, I hope I'm saying your handle correctly. We have so many programs to support you, whether it's connecting with Lauren through Embrace Your Fertility, or if you need financial assistance, we now are going to be working with the bundle program that has multi-cycle refund guarantee programs. People, this is a game changer. I have not seen the US adopt this. We have clinics in Spain who do this. And there's sometimes some qualifications to make sure that they can do this, but it's usually a year-long program. And what's amazing is that if it doesn't work within that year, you end up getting your money back, all of it.
Great.
So and the clinics are that they do partner with have reduced their fees by 20% and done this bundled offering. Exactly. And there's even a that part, there's not really a financial approval. If you need to finance the bundle, they have a financing partner, and that financing partner has a program where during that whole year you only have to pay interest.
Wow.
Isn't that amazing? So it literally is risk
That's
free
great.
compared to what we've always done, which is here's my credit card for the first cycle of 20 grand, or here's my credit card for
I
the all
know.
three
Don't
cycles
look.
of 60 grand. Yeah, don't look. Exactly. And then paying off that credit card at usually like an astronomical interest rate. I love their program and I'm so excited about it. So Chantal, feel free
Yeah.
to direct message me and let me know if you want some support on kind of finding the right, fit for you. And oh, Ellie, I did miss that question. So sorry. Does HPV affect fertility? What an important question.
That is a great question. It depends, I think, on what the results come back, of course, on how progressive it is, and so that's going to be very dependent upon each individual. But in general, I mean, technically, it could have an impact, but without knowing more information. And how it's being treated and so on and so forth, because all of those things could potentially affect future fertility or pregnancies depending on treatments.
Right, right. Now, Amy is asking a great follow-up question, which is if tubes are blocked, can they be unblocked?
So that is definitely something that on the fertility clinic side, we usually would see people that would come in and either they didn't want to have their tubes unblocked, they just wanted to have one more child, and so they were like, let's just keep it as is, do IVF and skip it. But then there would be people who came in because they did try to get their tubes unblocked and it was not successful. But others, it can be successful. I'm not sure the statistics for that, of course, but it is something that is worth a conversation to get more information about, for sure.
And sometimes the HSG procedure does do that.
It has been known to, yeah, for some people open up a little bit enough
Right.
to, whoa, we got pregnant that month. How did that happen? Right.
But
We
it
just
is
had that test. That was not the most pleasant thing, but hey.
exactly, exactly. It's not tried and true. It's not something that they can guarantee, but
Right.
sometimes it happens. A lot of factors go into it, like why are they blocked? What's the cause? Sometimes even if there's a temporary unblocking, they can reblock. And so sometimes it's just too many variables for people to deal with. And that's why they go straight to IVF, I feel like too, is
Right.
that it's just a lot of rolling the dice. And since every month you don't really know, are they open, are they closed? Sometimes it feels like even the attempts are a little bit more wasted time. So I always try to counsel people that if you have the funding and if you have the time, you have the most flexibility of all. The more that we dilute on time and money, and there's also the emotional bank account. So it's not just the money bank account,
Right.
it's the emotional bank account too. And if all of those things are getting diluted, then we have to look at the speedier options to success, starting with least invasive options, moving up. And so much of that is that, cost benefit decision making tree that people like Lauren, I think you're so suited to help people walk through.
Well, I do think that it's something, it's important to examine, of course, all angles. And sometimes people need help trying to look at all the angles and scenarios. And a lot of times, with any big decision in relation to fertility, whether it's how many embryos to transfer
Yes.
or, which financial program to choose,
Yes.
I really try to work with people to figure out what decision that they make on their own, not me for them, but what decision they make that's going to leave them with the least amount of regret.
Yes. I love that
That's,
perspective. That's everything. What can they
yeah,
live with? What can they live with? I think that is
right,
that's what it boils down to, right? And
right.
sometimes it means proceeding with maybe clinical paths that not everybody would think has the best prognosis, but it has the best emotional prognosis for the patient.
Yes, that is 100% right. Right there. I mean, I've seen people who say, everybody would think that I'm crazy for doing this,
Right. Mm-hmm.
but it's what works for you. So who cares?
Who
You know,
cares?
this is the choice
Exactly.
that makes
Mm-hmm.
you feel good about how you're going to proceed. And that's all that matters.
Right. Yeah. 100. Yep. 100%. I love it. That's why I love
This,
talking to you.
oh, well,
Jessica.
I think it's important for everybody who's in this world to really learn how to be a little selfish. You know, as
Yes.
caregivers, it's really hard from a medical standpoint sometimes to be
Mm-hmm.
selfish.
Mm-hmm.
But in truth, going through this process, everybody is affected in so many different ways that every once in a while, it's okay to be selfish. You put yourself first. This is your decision, your
Mm-hmm.
body, your choice, your relationship,
Yes.
your decisions. And so
Yes.
nobody should, you know, shame you or guilt you into any of that.
Agreed. They also shouldn't take advantage of where you're at and take your money though without
Of
telling you the
course.
truth. So there's a balance,
Yes.
but that's what I think, people like Lauren and me and Fertility Answers, we're all here to support that part of it too. To be advocates for you means advocating for what you can live with and advocating for what's ethical and and makes sense. So Jessica has some labs here. She's been trying to conceive for 1.5 years. She did have her day 3 blood work done. Her TSH was 1.96. That's kind of a perfect TSH.
Mhm.
So congrats on that. Yay, gold star. FSH 5.49.
Great.
Progesterone 0.5, not really indicative of a recent ovulation. So that's good, right? LH 3.3. Doesn't sound like a surge is
Expected.
coming, but it's like expected. Estradiol 159. Her transvaginal
And
ultrasound found no abnormalities.
yeah. So I mean, right there, you know, no red flags. Lots of, you know, lots of thumbs up
Yeah.
you know, gold stars.
But no AMH listed and no antral follicle count. So like
Exactly.
one of the biggest pieces of the equation is, but what does egg supply look like?
Right. And so that's where it comes to, you know, having all that information, right? You know, one piece
Mm-hmm.
of the puzzle can look perfect and everything looks great.
Mm-hmm.
But then, you know, you may be missing this tiny little problem over here, or it could be a bigger problem that, you know,
Right.
really does need to be examined. So it's important to have all of that information to be able to review the full picture.
Yes. And I would say, so Jessica, the things that are missing for me right off the bat is that progesterone level, when I saw it, it's not indicative that you've recently ovulated. So the question is, do you have confirmation that you're ovulating? LH surges are not confirmation that you're ovulating. So we would want confirmation. You can get confirmation at home if you use a kit like uva.life because they measure actual progesterone levels. It's a quantitative measurement. So you'll get a score number that's correlative to, going to a Quest or LabCorp for that lab. And they have an app that's awesome and it'll tell you when to start their testing. They give you tips on lifestyle improvements and things like that. It's really cool data. Their LH, they do measure both LH and progesterone. And I would definitely want to see an antral follicle count and get that AMH level done. And probably what Dr. Chen would say is it won't hurt to go ahead and get it a prolactin as well. Make sure your prolactin isn't elevated. And probably T3 too. Wouldn't we expect to see a testosterone? Make sure that the balance, like the balance of estradiol to testosterone is okay.
So to tell you the truth, that's a little bit more in depth than
Dr.
you
Chen's.
know,
Yeah.
yeah, I'm going to leave that for Dr. Chen.
I'm on so many lives with Dr. Chen. I'm always like, here's what Serena will tell you. I feel like I'm just her mouthpiece at this point. Yeah. Segrist is saying like, yes, it's painful. I agree. I mean, the HSG is not easy. And I'm just like thrilled that there is a much more comfortable route. Now it's uncomfortable quickly. So the one thing that I would say, so that, so that folks, Chantel, you're welcome. That folks, should know heading into it is don't be afraid of it, and if sometimes they'll give you a relaxer for your cervix if they feel like you're too tight to even get in there because you're nervous and have anxiety, there's things that you can do because it's quickly uncomfortable.
Right.
And
Yeah.
the same thing was true when I had to have my C-section. He was like, you're about to burn in your vagina. And I was like, what? He's like, it's going to last for 10 full seconds and we're going to count through it. That was a long ass 10 seconds. Let me tell you, it was crazy. I was like, oh, that was nutso. And, you know, and he was an amazing anesthesiologist. So from clear on out, from clear on, you know, the path forward is fine. But, you know, the 10 seconds was hard, but it's only 10
Yes.
seconds. And Dante got here, you know, healthy and fine. So, Selma's
Yeah.
asking how to avoid recurring miscarriage. And before we even talk about that, I want to check in, Selma. First of all, just make sure that you're getting emotional support and grief support around that. And I want Lauren to kind of address the grief support side. I also want to know, are these recurrent miscarriages? Are they chemical? Now we call them pregnancy loss. Are they chemical pregnancy losses, or are they, you know, after, is it week 9 or 12, Lauren, when it crosses over to
Um,
pregnancy loss?
well, it depends on when, if they see a heartbeat
So pre-heartbeat would be
and a
considered chemical
sac.
pregnancy loss and SAC, yes. And then, right. And then if the loss occurs after you've seen the SAC and hear the heartbeat. Okay, so Lauren, this is a tough one. And so many community members have faced loss after loss after loss. We have a community member who had 7 losses. She thought she was having another one. She's gotten further in this pregnancy than any of them. And it was a subchorionic hemorrhage,
Wow.
thankfully. But she was so stressed.
Yeah, I can't, it's so hard. I wish I could be like, do this and you'll never have
Mhm.
another loss, you know, take this pill or
Mhm.
turn around in a circle 4 times.
Mhm.
There are so many variables that go into the loss. It could be something to do with the egg or the sperm, could be something to do with the hormones in the body, could be something genetic, blood clotting, so many different things that could be causing a loss that it's hard to say, you know, do this or don't do this. But it is important to give yourself the best chance of success, to be, make sure you're taking care of yourself, of course, number one.
Mhm.
You know, you mentioned, Alice, about the emotional aspects. So first off, you've got to be able to make sure you are processing through the grief that
Mhm.
you're feeling. Every single one of these compounds, it doesn't go away once, you know, you get pregnant
It's
again. We
trauma.
know that.
Mhm.
And so it's really important to make sure you are talking with somebody, whether it's, you know, a partner, a best friend, sister, or an actual professional,
Yes.
productive mental health therapist. It is so important to cross that almost first, you know, before you even work on the rest, you know, working through, because you've got to be able to, you know, breathe again. And sometimes
Mhm.
that's, you know, you're just kind of powering through and you're not really present.
Mhm.
So, you know, beyond that, once you get through and you feel, you know, you are a little bit more refreshed and ready, you know, to look forward, it's important to, if there is multiple losses, definitely time to talk with somebody to get some further
Mhm.
testing done. There is full recurrent pregnancy
Absolutely.
loss panels that can be done.
Yes.
They can check the uterus, make sure there's nothing in there that would be interfering with the pregnancy. You know, there are so many different things that can be tested based on when the losses are happening,
Mhm.
you know, and your history as well. So it's important to talk with a medical professional to see what type
Mhm.
of further evaluation might be helpful. Sometimes
Absolutely.
simply taking a daily injection of Lovenox, you know, blood thinner,
Mhm.
and
Mhm.
that's all it takes, which sounds
Mhm.
like a lot, but you know, compared to going through all kinds of
Mhm.
treatment and other things, you know, some people are just so thankful to find one thing that they can fix
Right.
and move on, and be successful with that. So it is important, though, I sort of glossed over, but to have a good foundation for
Mhm.
your health and wellness. And that's where we get into optimizing your body with your nutrition and hydration and movement, making sure you're sleeping
Mhm.
well. I know, Alice, we've talked about that
Mhm.
a time or two. I actually just recorded a video for somebody on sleep and fertility. And as I'm recording it, I'm like, I'm so bad at this. I
We've
mean,
talked about
like
that.
massive failure right now with the
Yeah.
move and everything,
Oh
you
my
know, and
gosh.
we've talked about our fur babies. I mean, I'm
Yes.
being terrorized daily. So
I'm being terrorized by mine too in my temporary housing. It's disrupted my sleep so badly. So
yeah,
that is a big thing is I am being terrorized by my cats.
but you know, I mean, so to bring that back to fertility, I mean, sleep is
So
important for
important.
all brain
Everyone.
function.
Yes.
And, but when you get to the hormones and regulating the stress hormone and versus the
Mhm.
sex hormones, sleep is important for fertility. It truly
It
is. And
really is.
it's something that can be I say that it should be able to be, easily tackled, at least, one or two small changes. I
Hmm.
did last week. I said, I'm going to go to bed 15 minutes earlier every day.
Ooh.
And I mean, I made it 3 days, but
And I
it,
have so many tricks that the cat I'm serious, you guys. I have a cat who can open the door, and I will stack all of my son's stuffed animals in front of the door to try to prevent him from being able to get to it. And I'll put a weighted blanket on the other side. That's how hard I'm trying to get him to not terrorize me in the middle of the
I,
night. It's
I feel
hardcore.
you. That's hilarious. My nightstand is full of, I now have a pillow on it, 4 water bottles, a spray bottle,
Right.
and like he's still on there every night. I don't wiggling his way in. I don't get it.
I know. I'm one point, this cat shattered my son's water glass in the bathroom right when
Mm,
Dante fell asleep into 8,000 pieces. And
gosh.
it scared him. It scared the cat as much as it startled us. But yes, get rid of the fur babies in the bedroom. They don't belong. The
Yeah,
dog is
yeah.
fantastic. My dog, she just stays asleep the entire night and it's wonderful. But no, these cats, when they have transitions, they're just terrible. Terrible, terrible. We're in a transition home ourselves until we move into the farm next week. Chantal's asking a follow-up question about she does have hydro cell pinks. And so unfortunately, the liquid cannot be removed, Chantal. So that does mean that a reproductive surgeon, a reproductive endocrinologist would absolutely want you to remove those tubes, because even if one of them was open and you still had that condition, it's going to prevent implantation. And even if implantation happened, your risk of miscarriage is so high. And so it's just not worth it. It's not worth it. You don't need those tubes. I mean, knowing that both of them are almost completely blocked, you don't need them anyway, and they don't produce hormones for you. It really is, in your case, better for your long-term fertility plan, for them to just be removed. And there's an opportunity. I think anytime somebody has kind of an inflammatory fluid condition, there's always that conversation around maybe working with a Dr. Raquel, who's a naturopath or fertility specialist, with an anti-inflammatory diet anyway, just to sort of reduce the body's ability to have fluid buildup kind of anywhere. I'm a fluid buildup, like, by genetics. I mean, when I was pregnant, I retained so much water from head to toe. And so there's no scientific evidence about this, that there's nothing that you're doing that caused it at all. So I want to be clear about that. But I do think that when we have conditions like that come up, it's just kind of a good opportunity to go like, hey, maybe I should be on an anti-inflammatory diet while I'm trying to conceive, and even gearing up for IVF. And you're so welcome for answering those questions. We get long-winded, so sorry if we don't get to them quick enough. I'm just running through saying hi to. I'm seeing some people I haven't seen in a while, like Zucchini. I always love her handle. It's so cute. So we don't have any other questions, and so I think we'll just go ahead and wrap up. Lauren, it's always such a treat to have you on. Thank you for all the amazing work that you're doing. Folks can connect with you on the Fertility Answers app. They can request a consult with you, and they can also just go to your website, embraceyourfertility.com, and get started there, right?
Actually, it's embracefertility.com.
Oh, it's just your handle that's Embrace Your
Yes.
Fertility. Yes. So
Right.
embracefertility.com, because there's a UK organization that's on
Yeah.
Instagram under Embrace Fertility. So yes, thanks everybody for joining us. I hope that we were energetic enough. I'm exhausted today because of that cat issue myself.
Oh.
I'm a mess. I had like running mascara and everything right when we were getting on, and Lauren looks perfect. She's like camera ready, pristine, camera ready. So next week is going to be a really exciting week for us because it's National Infertility Awareness Week. So we have a lot of amazing events for you. We have our Monday motivation, and then Tuesday is my first time that I'm going to have our OBGYN Dr. Sherry plus Dr. Chen on the line at the same
Wow.
time. So we're going to practice on Sunday. We were hoping
Oh,
Dr. Raquel was going to join us too. She'll join us for our next group activity. I also have an Ask Her Anything on Wednesday with Dr. Suchdev, and she is phenomenal. She was so great. And then she's going to join again on Thursday with a trauma-informed panel. This is so important. It's going to be with a team that trains clinics and trains staff on kind of in trauma and being a trauma informed advocate and what that looks like, what that means. And that's going to be a really compelling panel. And that's on Thursday. Look for our orange posts. My son contributed video and himself in orange. So some cute things coming up next week. We love you all so much. Feel free to DM if you need something further. I'll connect you to our fertility advocates. I'll connect you to Lauren. I'll connect you to a clinic. I'll connect you to me. Just let us know how we can be helpful. Lauren, thank you.
Thank
Enjoy
you.
Del Mar.
Bye.
Bye.